Let's talk about some of the clinical symptoms that you might experience if you are suffering from an eating disorder. Some of these symptoms, particularly the seventh symptom that we're going to discuss today, are surprising to many individuals with an eating disorder, and unfortunately are things that many well-intended providers will try to correct through even further food restriction. So it's really important to know some of these clinical signs of malnutrition as we are trying to recover from our eating disorder, to know how to treat some of these symptoms and further progress that eating disorder. My name is Shena, and I'm a registered dietitian specializing in the care of persons with eating disorders. So if that's something that you're interested in, definitely click that subscribe button below. So the first thing to change as people restrict their food is often blood sugars. Low blood sugars or hypoglycemia, low blood sugars, also known as hypoglycemia, might be some of the first things that a person restricting their food could experience. What might surprise some individuals is we might also see high blood sugars when someone is experiencing an eating disorder if they are engaging in diuretic use. Blood sugars often result in dizziness, lightheadedness, fainting, and sometimes even more potentially life-threatening impacts. While these are the first thing to change, they are also one of the most dangerous things that a person with an eating disorder can experience. A symptom of an eating disorder that people often experience in the early stages of the eating disorder are a slow or rapid heart rate, so either bradycardia or tachycardia. This can occur from a multitude of reasons, including changes in the structure of the heart muscle, changes in blood flow, and diuretic use and purging. Third thing that someone with an eating disorder might experience is low blood pressure. While low blood pressure can be a symptom on its own, a person might also have normal blood pressure, but might have something called orthostatic hypotension, which is a significant shift in the systolic drop in blood pressure from standing to sitting. This is often an overlooked symptom. You have an eating disorder or a loved one has an eating disorder. It's really important to have that healthcare provider take the blood pressure both lying down and then immediately after standing up and looking at the systolic difference. The fourth thing that might change for a person with an eating disorder is high B12. This can occur sometimes because folks with eating disorders might have excessive energy drink use in order to try to curb their appetite as well as replace some of those meals. B12 can also occur as a result of kidney insufficiency. The fifth thing that might change with an eating disorder is low creatinine. This can occur from overall starvation, fluid loading, or just a general low protein intake. The sixth thing that might change is thyroid changes. This can include shifts in both thyroid stimulating hormone, TSH, in lab values, or free T3 or T4. And the seventh and oftentimes most surprising thing to many individuals that might change with an eating disorder is that person might experience high cholesterol. High cholesterol is one of the more common symptoms of an individual experiencing an eating disorder. Cholesterol is one of the more common symptoms of individuals that are experiencing an eating disorder. Unfortunately, many well-intended providers often prescribe low fat, low saturated fat, and low calorie diets as well as weight loss if a person comes back with lab values that are high in cholesterol. This often exacerbates that eating disorder voice, furthers that malnutrition, and oftentimes results in even higher cholesterol. The only way to ultimately correct these and keep yourself safe is going to be a full and lasting recovery from your eating disorder. These are just a few of the clinical symptoms of an eating disorder. There are many, many more lab values that might shift as you experience malnutrition. However, these are some of the more common ones. One thing that is really, really important to know, in lab values might be some of the last things to change or may never change even after prolonged starvation and malnutrition. I hope that you found this video helpful. If so, please consider liking, subscribing, and sharing with a friend.